Hi, my name is Rayan and I'm going to be your student nurse for today. Today I'm going to be teaching you guys how to take care of your child's tracheostomy tube. So the first thing I'm going to teach you guys is how to suction your child's trach. So basically, the first thing we're going to do after all the safety checks, we are going to make sure that the child is in a comfortable position. It's easier if they are lying down so that we will be able to suction them better so that they wouldn't be moving as much. And this position is also more comfortable for you guys and it will be easier for you guys. So first, we have to make sure that we have to recheck that all of our equipment is actually present. And then we're also going to make sure that our hands are clean by washing them or putting hand sanitizer on. We can also use gloves because as a nurse, we put on gloves, masks, and we also put on a gown when we're suctioning our patients, but you guys don't have to because you guys are the parents of the child. So this is optional for you guys. Then we can take our sterile water and we can pour some in a cup because we're going to use this to kind of clean out the tube after we suction and every time before we resuction the patient. This could also be used to kind of lubricate the tube beforehand before we insert it into the tube. So yeah. So the first thing we're going to take out is the suction catheter, the packaging, and also we're going to take the suction tubing. So by placing your thumb on the hole in the suction tubing, make sure that it's working when you turn it on. Make sure you feel the suction. And also you're going to attach the catheter into the tubing. Then you're going to use your dominant hand and hold the suction catheter end where the control suction is. That's where you're going to want to put your thumb when you do suction. And then you're going to want to take your non-dominant hand and as you slowly take out the suction catheter from the packaging, you want to make sure that you're not touching the tip of any of those. Okay, as you're slowly taking it out, you guys want to wrap around the excess catheter and then making sure that you take it out without flailing it around. You want to pinch where the number is of the depth that the doctor ordered for you to go when you're suctioning your child. So basically, your child's depth that the doctor ordered is 12 centimeters. So you want to put your two fingers, your thumb and your pointer finger onto that number, and you're going to be holding it in such a way like this, that your suction tip is pointing down and you're holding the suction control. You're able to put your thumb on the suction control. Okay, so now we're making sure that your child is in a good position. You want to make sure that you're doing this slowly. When you put the suction catheter in, you put it in slowly without putting your thumb on the control. This is without the control. You put it in. Then once your thumb reaches the tip of the tube, you want to put your thumb onto the control. And then you want to do a little twisting motion as you're taking the tube out carefully and gently. This movement when you're taking out the tube should take maximum of 10 seconds. And then you want to put the tip into the sterile water, suction out a bit to kind of clean it out before you want to deep suction again. And also before you do another deep suction, you want to make sure that you give your child 30 to 60 seconds to kind of recover from it. Now I'm going to teach you guys how to change your child's tracheostomy tube. So the first thing we want to do is do all our safety checks like we did before with the suctioning. We want to make sure everything's working, everything's fine. We also want to make sure that the suction is ready to be used just in case of an emergency. So the first thing we want to do is gather all the equipment, make sure we have everything. you also want to explain to your child what you guys are going to do just to keep them calm and settled down. You also want to make sure that you're monitoring their oxygen status during this time, because you want to make sure that they're not in any respiratory distress. Before we start, we have to make sure we wash our hands, and also, again, gloves are optional for you guys. So the first thing we want to do is check the new tracheostomy tube. We want to make sure that the obturator that's inside goes in smoothly and goes out smoothly. So we can lubricate it with normal saline, or we can use water-soluble lubricant. So for this, we're going to use normal saline. We're going to lubricate it, and we have to make sure that it goes in and out smoothly. And once we make sure that it goes in and out smoothly, we want to lubricate the tip of the tube that actually goes into the stoma of the child. So we're going to lubricate that with a water-soluble lubricant. So once that is lubed, we can set it aside, and we can keep it on a clean wet pad and make sure that the shaft is pointing upwards, because we don't want it to be contaminated. So now we're going to make sure the child is in a comfortable position, and for this, the child is lying down, so we're going to roll up a towel, put it under their neck, over here, or under the shoulders, to keep their neck extended like this, so it'll be easier for insertion and it'll be easier to take out the old tube. So we also want to make sure that before we take out the old tube, that the airway is clear, no secretions are there, no mucus. So we're going to suction if there is mucus, like we learned before. And if there isn't, then we're going to proceed to the next step. So we have to make sure that we establish our roles. So for this example, the mom is going to be the main person, and the dad is going to be the helper. You always do a tracheostomy change with two people, because one person always has to have their hand on that tracheostomy tube to keep it in place, the old one. So to start, mom will be in charge of removing the Velcro straps from the tube by releasing it once at a time, and the dad will be holding the tracheostomy tube. And when you release the old tube from the Velcros, you want to take it out while holding the old tube still in place. You take out the Velcros. At this moment, you guys can clean the stoma around it, just to make sure it's clean, not dirty. And then while the dad is holding the tube in place, the mom can get the new tube and hold it by the neck plate and make sure it's ready for insertion. So in a count of 1, 2, 3, the dad will take out the old one, and the mom will put the new one in. At this point, we're going to make sure that the tube goes in smoothly, and we're not putting any pressure on it, because it should go in smoothly, and it should be going in like this, because the shape of the trach tube goes like this, and so does your throat. So once it's in there, the mom has to make sure that she's holding the new one in place while the dad puts the old one aside. Then you take out the obturator, and you want to put on you want to lift the child's head up while the dad puts the new Velcro, the new necktie around and into the other side, and making sure it's secure on both sides, while still keeping that hand on that trach tube. And once that is done, we release, and we make sure that we clean up ourselves. We make sure that we do not throw out the obturator, because it can be reused, cleaned, sterilized, because it could be used again. And we're also going to make sure that the tube, the old tube, is also reused, is also sterilized, and is given back to the respiratory therapists.